very good day. My name is Dr. Jayachandran. I am a consultant neurologist at SPARSH Hospital, Infantry Road, and I am here today to speak on, share a few tidbits on stroke. Essentially, stroke is any neurological condition which leads to deficits, which is related to the blood supply of the brain. It can either be due to a sudden cut-off of blood supply to a portion of the brain or the central nervous system, or excessive flow in the form of a bleed in any portion of the brain or other parts of the central nervous system. And stroke, unfortunately, is a very catastrophic event, and it can lead to significant disability and, in extreme cases, death. And it's among the leading causes of death in hospitalized patients, and it is the number one cause of disability in the community. There are several risk factors for stroke, and these need to be highlighted in particular because there are patients, the age group of patients who are suffering from stroke, we will be seeing younger patients coming to us with stroke symptoms, and we found that stroke is linked with blood pressure and diabetes primarily. Lifestyle and habits like sedentary lifestyle, lack of physical activity, cigarette smoking, tobacco abuse, alcohol abuse, all these things predispose to stroke, and these are all preventable causes of stroke. There are certain other risk factors like genetic factors in the age which you can't do much about, but there are so many modifiable risk factors which can be averted and can be taken care of, and stroke can be averted. It's important to identify stroke early because with the advent of some newer treatment modalities, the earlier you identify the stroke, the better the chance of reversing stroke symptoms in certain situations. So in the community, there is a mnemonic called FAST, wherein F stands for drooping of the face, A stands for arm weakness, S stands for slurring of speech, and T stands for time. So if you have a person who's having drooping of the face on one side, who has one-sided arm weakness, or has slurring of speech, or is not able to understand what somebody else is saying to him, then it's very likely that the person with a combination of one or more of these symptoms is having a stroke. And in such a scenario, it's T stands for time. It's time is of the essence, and you need to rush a person with these symptoms to the hospital, because within a certain time window, there are certain medicines and there are certain procedures that can be done which can potentially reverse stroke symptoms. So once you have identified these symptoms in a patient, there is no role for first aid in stroke. You have to get the patient as soon as possible to a stroke ready center, and these days most clinics and most hospitals have access to a CT scan. A CT scan is generally sufficient for us to make a diagnosis of stroke and initiate treatment. Within the first 3 to 4.5 hours of a person who's had stroke as a result of ischemia, that is cut off of blood supply to a portion of the brain. In these situations, there is a modality of treatment called intravenous thrombolysis that is available, and for the initiation of this treatment, in general, a CT scan is sufficient. You do not need an MRI, you do not need complex investigations. So this is something that we need to be taking to the peripheral centers. We need to be educating people about this, and the availability of the drug is also fairly widespread. Most places in India have this particular drug available, including some of the smaller centers. There is a drug called tissue plasminogen activator, and there is another drug called tinectaplase. These are the two drugs that are available for the administration intravenously. These drugs can dissolve the clot and restore blood supply to the portion of the brain that has been affected, and can potentially salvage brain tissue. In certain situations where the blood vessels of the brain are blocked, there is a role for something called a mechanical thrombectomy, which is in essence like doing an angioplasty in the brain. This, of course, requires more sophisticated equipment, and you need to take the patient to a comprehensive stroke center where there is availability of a cath lab, and a radiologist or an interventional neurologist should be available who is able to do this procedure, wherein they put some wires and catheters and try and take out the clot. under visualization through an X-ray. And again, this is a very effective procedure in terms of the ability to prevent the stroke from expanding and to try and limit the damage that is caused by stroke. These are newer modalities of treatment that have been available to us over the last decade, and the advances that are occurring in this field are quite staggering, and every year there are new advancements that are happening, and these are modalities that are now available in many centers in India, and people should be aware of this. So the earlier you identify the stroke symptoms, the better it is for the patient, and the better the chance you have of salvaging brain tissue and in effectively giving the patient a better outcome. So there is a concept in acute stroke treatment called time is brain, and this is gaining a lot of importance and significance in the recent past. The concept here is that the longer you take to restore blood supply to the portion of the brain that's affected, the more the nerve cells that die, and you're losing millions of nerve cells and millions of connections between nerve cells every second that you delay treatment. So the earlier you initiate the treatment, the better the chance, like I said, of better outcomes in the patient. So time is brain is essentially means that the earlier you treat the patient with acute stroke, the better the likelihood of a good outcome, because you are able to save more brain tissue. So as with most medical conditions, prevention is always better than cure in stroke, and it's important to identify risk factors, especially the modifiable risk factors. So the main modifiable risk factors in stroke are high blood pressure, diabetes, and your lifestyle. So this is something that's very important these days, because we're seeing patients in the younger age group develop strokes because of these problems. So it's important to monitor your blood pressure and your diabetes on a periodic basis, your blood sugar rather on a periodic basis, and go for regular health checkups, probably once a year or once in 2 years, once you're past the age of 35. And in case you have a problem with either of these, if your sugar levels are high or your BP is high, you should get treated adequately for it. Cholesterol is something that needs to be checked every year or so, and in case the cholesterol is high and you have other risk factors also, then the cholesterol needs to be brought under control with medication or with diet modification. So on that same note, your diet becomes very important, and the emphasis should be on a plant-based diet which contains more vegetables and fruits. Animal products, if at all you're consuming meat, it would be preferable to consume white meat rather than red meat. And if you are consuming food of that nature, then your physical activity should be commensurate with the amount of food that you're taking in, so that you don't put on weight. Overweight patients in particular have a tendency to develop a condition called obstructive sleep apnea, wherein the tongue falls back when you sleep, and it covers it blocks the upper airway and prevents air from flowing in, and that leads to snoring. And this is something that can be treated very easily with a machine called a CPAP machine, continuous positive airway pressure machine, and with weight reduction. Obstructive sleep apnea is an under-recognized risk factor for both stroke and for heart attacks. It needs to be treated as soon as possible, if at all it is identified. And it is something that patients need to accept, that they may be having a disturbance in their sleep, which may be leading them to an increased risk of both strokes and heart attacks. So in summary, prevention of stroke is better than cure, always. Please remember that. With most medical conditions and with stroke, prevention is better than cure. So it's important that you identify risk factors early, and if you have them, correct them as soon as you can. In the community, identifying stroke symptoms early is of the essence, because there are treatment modalities available wherein if we are able to initiate them quickly, then we can limit the amount of damage that a stroke causes. So if you see a person with stroke symptoms, one-sided weakness, if they have slurred speech, please rush them to a hospital as soon as you can. There is no question of waiting, there is no question of first aid. And once you are in the hospital, leave it to the doctors to decide. In most cases, like I said, the CT scan is generally sufficient for us to make a diagnosis along with the clinical picture and initiate treatment. And there are injections available these days with which we can dissolve the clots that are causing strokes. And in some situations, the patient may require an angioplasty to be done in the brain to extract the clot. These are newer treatment modalities that are now coming through in a big way in India also, and it's important that everybody acquaints themselves with these. So, to summarize again, prevention of stroke, and in case stroke does occur, then please rush the patient as soon as you can to the hospital so that treatment can be initiated at the earliest. Thank you.